Assalamu alaikum. My name is Hafsa Khalid and my roll number is BP1650077. I'm a student of 5th professional pharmacy and I'm from morning shift. So the drug that I was given to present was Cefixime and I would like to start my presentation now. So Cefixime, it is an antibiotic and it belongs to the class of cephalosporin and specifically it belongs to third generation cephalosporin. Cefixime is highly stable against the action of beta-lactamase enzyme, and for this reason, it is used against the treatment of microorganisms that may be resistant to the action of penicillins because those organisms are susceptible to cefixime. When it comes to the antimicrobial activity of cefixime, it has expanded gram-negative coverage and also has the ability to cross the blood-brain barrier. Other than that, the third generation cephalosporins, they can be hydrolyzed by MC beta lactamase enzymes, which are cephalosporinases. But the antibacterial spectrum of cefixime is very broad. In case of gram-negative organisms, it covers E. coli, Haemophilus influenza, Neisseria gonorrhea, and other gram-negative organisms. And in case of gram-positive organisms, it covers Streptococcus pneumonia, Streptococcus pyogenes, and in anaerobes, it covers Peptostreptococcus and Peptococcus species. The rational use of cefixime, it is indicated for the treatment of infection of upper and lower respiratory tract, otitis media, and for the treatment of infections in genitourinary tract. Dosage of cefixime. Cefixime is commonly available in 3 dosage forms, in the form of capsule, in the form of tablet, and as oral suspension in the given doses. And the doses when cefixime is prescribed for the treatment of chronic bronchitis, which is caused by Streptococcus pneumonia or Haemophilus influenza, it is given in 400 mg per day per oral in single daily dose or divided by 12 hours. And in case of otitis media, against Haemophilus influenza, Moraxilla cadhealis, and Streptococcus pyogenes, it is given in 400 mg per day per oral in single daily dose or divided by 12 hours. For uncomplicated urinary tract infections, which are caused by E. coli or Proteus mirabilis, it is given in 400 mg per day per oral in single daily dose or divided by 12 hours. And finally, for the treatment of typhoid fever, it is given in 15 to 20 mg per day per kg per day per oral divided by 12 hours for 7 to 14 days. Some considerations need to be made while prescribing cefixime. So if you are giving cefixime for the treatment of infections caused by Streptococcus pyogenes, then it needs to be administered for at least 10 days. And in case of adults, 400 mg single dose or 2 divided doses for 7 to 14 days are prescribed. For uncomplicated cervical and urethral infections, 490 mg oral dose is recommended. And for children, suspension is very safe and easy to take, and it is recommended in different doses for different age groups. For under 2 to 6 months, it is not recommended at all. For 1 to 12 months, which is 1 year, it is given in 3.5 ml per daily, and for about 1 year to 4 years, it is given in 5 ml daily, and 5 to 10 years, it is given in 10 ml daily. And if the child is over 50 kg or if the age is over 10 years, then 10 to 20 ml per kg is fine. And as far as the safety of cefixime in pregnant women is concerned, 1 dose of cefixime is safe. Side effects and adverse effects. Cefixime also has some side effects, which are chills, confusion, anorexia. It can be concerning. GI bleeding, fatigue, fever, diarrhea, increased LFTs, heartburn, glossitis, candidiasis, and nephrotoxicity, proteinuria, bronchospasm, and other symptoms. The drug-drug interactions, when cefixime comes in interaction with aminoglycosides, it can result in additive nephrotoxicity. And if it comes in interaction with loop diuretics, again, it can cause increased nephrotoxicity. And in case of interaction of cefixime with oral anticoagulants, enhanced hypoprothrombinemia can occur, which is the disability of clotting or decrease in clotting. The alternatives for cefixime, there are three alternatives. First one is ciprofloxacin. Ciprofloxacin is highly effective antibiotic and it treats wide variety of infections. So if cefixime is not available, ciprofloxacin can be recommended, but it should not be given to children aged less than 12 months. And in adults, it should be only be reserved for infections that are not treated by other antibiotics. Neutrofurantoin, it is a very good drug for the treatment of urinary tract infections and bladder infections. It is a very good antibiotic with low risk of inducing bacterial resistance. So it can be recommended instead of cefixime. Next, we have ceftriaxone. Ceftriaxone, if you look at it, it is just as good as cefixime, but the problem is that it is only available as an injectable. So the patient has to go to the hospital or to the doctor for its administration. But if we look at cefixime, cefixime is very commonly available in an easy dosage form, and which ultimately makes it easy to take. Here I have the brands for cefixime, which are categorized according to low price and high price. If you look at the total range, we see that cefixime is not very expensive. It is not very high-end product, and it is very pocket-friendly. The low price ranges from 190 rupees to 310 rupees, and the high price doesn't have very much drastic variation. It varies from 350 rupees to 380 rupees. The additional use of cefixime, just like any antibiotic, the prescription has to be very correct. There has to be no case of self-medication when it comes to taking antibiotics. The incorrect doses, they can be very dangerous in case of antibiotics, and also the frequency of intake has to be correct. And if in case of irrational use of cefixime, obviously toxicity can result, and this toxicity, unfortunately, it cannot be undone by any antidote, but gastric lavage has to be performed, because even dialysis cannot remove significant quantities of cefixime. Now, finally, I have a case study, which is about a 30-year-old woman, which has been prescribed cefalexin 500 mg 3 times a day for 1 week. And because she's pregnant, she is worried about possible effects on the developing baby. So in this case study, we will be studying or prescribing her alternative medication and alternative ways to treat UTI. Here I also have some questions which are going to be answered during the assessment. But first, let's take a look at our subject. The subject is a 30-year-old woman who is pregnant and has been prescribed cefalexin. And our object is to prescribe her a treatment that is safe for her and for the developing baby. And in the assessment, we have some questions which are: what organisms cause urinary tract infection? We know that there are a wide variety of organisms that can result in urinary tract infection, but the most common culprit is E. coli. Now, what is the incidence of UTI in pregnancy? So the chances that a pregnant woman gets UTI is very high, because during pregnancy, urine has more sugar, protein, and hormones in it. And also during pregnancy, the growing uterus, it presses on a bladder, and which ultimately results in slow urination, and it makes it hard for the urine to pass out. Other than that, the signs and symptoms: a strong persistent urge to urinate, burning sensation while urinating, passing frequent small amounts of urine, urine that appears cloudy, urine that appears red, bright colored, or cola colored. These are the signs of blood in the urine, and strong smelling urine is also a symptom of UTI. What are the possible complications of UTI during pregnancy? So the complications are very obvious, and it is like no question that is UTI should be treated in pregnancy, because it can result in maternal chorioamnitis, which is it can cause the rupture of chorion membrane and amnion fluid membrane, and it can also cause the retardation of intrauterine growth, and it can also result in low birth weight baby. And the antibiotics which are safe to be prescribed in pregnancy are sulfamethoxazole, fosfomycin, mutafirintone, ceftriaxone, and cefixime. So now the final assessment of the patient. Cefixime, it is a new oral cephalosporin. It is more active against microorganisms, and about 20% of the drug is excreted by the kidneys as active drug. Therefore, it is very good for the treatment of urinary tract infection and can be prescribed, because the animal studies support that there was no as such effect on the fetus, and it therefore proves that it is good for treatment of UTI in pregnant women. What nutritional advice could you offer the patient to aid a healthy pregnancy? Drink plenty of fluids, because hydration, it can reduce the risk of urinary tract infection. Vitamin C intake, as it is an antioxidant. Cranberry juice intake, and probiotics. They can be prescribed to treat the UTI naturally. So the final plan is 400 mg of cefixime per oral. One oral dose is safe. Furthermore, increasing water intake helps with cranberry juice. And in terms of food, there should be increased intake of cranberries, blueberries, oranges, dark chocolate, unsweetened probiotic yogurt, tomatoes, broccoli, and spinach. And smart drink choices are to drink decaffeinated coffee, to drink cranberry juice and blueberry juices and pomegranate juices, and black or green teas. Other than that, again, I have already mentioned, but the plenty of water is also very good for fighting off UTI. So this is it for my presentation. I hope I have covered all the points, and I hope that you like my presentation. Thank you so much.